Good Life Trust is the only organization with programs on climate change and health in the entire country. It is a force to reckon in changing lives of many Kenyans, including those living in informal settlements.
Good Life is the only organization that is doing climate change and health. And in the next 10 years to come, we would love Good Life to have more funds and more partners, and as well more employees.
Just like the name it is, life would be good for everyone in the country, and also dependent on how much they will be able to cover the counties, because we have 47 counties, and perhaps they may not be able to cover the entire 47 counties. But it's our wish, if they can be in the 47 counties, the better for us.
The Ministry of Health, the Department of Environmental Health, has been implementing a project known as Greening Hospitals. As Good Life Trust, we have also decided to partner with them because now we want to expand the project. They have reached a few hospitals in Kenya, but now we want to expand so that now we are reaching all the level 5 hospitals in Kenya.
Through initiatives such as conducting communal cleanups, tree planting, a move that has seen them participate on local and international forums touching on environment and climate, such as the United Nations in New York.
But right now we are introducing the microwaves and autoclaves, whereby you put the medical waste, all sorts of medical waste, and then they are autoclaved, and the byproduct can be used maybe to make building materials, or even if it cannot be used, now it is smaller and not less pollutant to the environment.
I do resource mobilization. I represent a Good Life Trust in I-Forum, like overseas. For example, last month we were in Bangkok. We were doing a conference for SDG 7 on climate change and health as well.
This has seen Good Life Trust get attention from key players such as the government due to the kind of community-based work they engage themselves in. Daniel Kavo, the acting head of Community Health and Developmental Unit at the Ministry of Health, has spearheaded the trust partnership with the government.
Actually, Good Life is one of the new partners we are engaging with. And Good Life is an organization that works in climate change and health. And one of their strategic mandates is to engage in capacity building of staff in the interventions of improving community health in the country. And we have a memorandum of understanding to synergize each other.
The community-based NGO engages itself in activities around informal settlements, such as the slum areas, depending highly on community health volunteers to reach to the populace in running its day-to-day activities.
Is whereby you ensure that the hospital facilities are environment friendly. For example, when we are talking about waste management in the hospitals, they have the old way they have been doing it, using the incinerators, maybe to burn the sharps from that are being used in the hospital.
We would like to work with the government, continue working since we are working with the government.
Other objectives of Good Life Trust are improve reproductive, maternal and child health indicators, improve livelihoods of adolescent and youth, improve lifestyles of street families and communities with or at risk of drugs and substance abuse, broaden partnership base to leverage on resources and complement other partners' activities, engage in capacity building of staff in health interventions at national and county level. According to GLT head Faith, going forward, the organization aims to continue forging partnerships throughout the country, both at national and county level, as a way for communities to identify and prioritize their needs, while at the same time pursue solutions. mainstreaming of climate change interventions, more so in the health sector, through initiatives such as policy intervention, awareness creation and programs implementation and advocacy for adoption of new policies.